Hello, my name is Dr. Abi. I welcome you to this lesson number 5 of this video course on this book, The Right Treatment for the Right Disease. This is a book that talks about all the various healthcare systems that are available to us, classified broadly as alternative and orthodox medicine. It's to help you make the right decision, make the right choice when the need arises. So in this lesson number 5, we are looking at some rivalry explanations apart from the placebo that can explain why people get to report some positive health outcomes when they are on certain treatments. So number 1, we have conditions that we describe as self-limiting. These conditions resolve by themselves. So if somebody has a common cold or a flu, and this is caused by a virus, we believe that the virus will clear by itself and the infection is going to be cleared by itself and the symptoms may improve with time. So sometimes what we do by giving treatments is usually to manage the symptoms so the person can feel comfortable. So we give some nasal drops, some pain medication, take care of body aches or headaches, for instance, or some fever. But basically, we are not giving medication to kill the virus. The condition is described as self-limiting. It goes by itself. So if somebody is taking a medication for a condition that is self-limiting, let's say somebody is giving antibiotics for a viral flu or cold, all right? The antibiotic did nothing, all right? The condition resolved by itself. So if you are giving a treatment like an alternative medical treatment, and then you are dealing with a self-limiting condition, you cannot conclude when you have positive outcomes that it is the treatment that worked. We have to account for the fact that the condition is self-limiting. A second reason why people can report that they feel well is because of what we call remission periods. In some diseases, even in some types of cancers, it is believed that there are periods where the symptoms are improved, all right, because the disease is going through a certain stage or period, okay? So symptoms can get improved a little and the disease is not gone, okay? It's called remission period. So people can experience some relief in symptoms. In those cases or in those instances, when a person is taking a medication and the symptoms coincidentally improve, it does not mean that it is a medication that is working, all right? It is because there's remission of the disease at the time, okay? Then we have what we call positive lifestyle changes. Now we know that when you exercise, it can reduce your blood pressure. We know that when you practice appropriate diet, it can reduce your blood sugar to some level. So if somebody is taking a medication and the blood sugar or the blood pressure has reduced to a certain level, we don't say the drugs are responsible for the positive health outcomes without accounting for the fact that the dietary regimen or the lifestyle changes are also helping bring down the sugar and or the blood pressure, okay? So all the time, when you're conducting studies, research on drugs, we account for these things. We account for the self-limiting conditions, account for these remission periods, account for the positive lifestyle changes before we can give credit to a drug. So we are very careful to say an alternative treatment is working without accounting for these rivalry explanations, all right? A fourth possibility why people might report that they are feeling better from some treatments is because of what we call bias reporting. Okay, bias reporting. So these people are not really representing the truth. They want to please the one who is giving the medication or the treatment. You ask them, so after giving this medication, your pain was at a scale of 8. After giving the treatment, what is it now? A person could say that it has reduced to 6. Now, this is subjective because you cannot measure the pain the person is feeling. okay, objectively. So you have to rely on the person's report. If somebody wants to please the provider or the practitioner who is applying that treatment, the person could just say, I feel better, to make him or her, or to make the practitioner happy. Okay, but that is what bias reporting or false reporting. Okay, these four reasons, as well as the placebo effect, making it 5 reasons, are reasons why we don't say that a treatment works until research has been done with appropriate protocols followed and all these rivalry explanations have been explained away or accounted for. Okay, so we are building on knowledge. All right, the next thing we are going to talk about is how orthodox treatments are made. Okay, so we're going to talk about preclinical trials, clinical trials. How do we arrive at orthodox medical treatments? Or how do we arrive at evidence-based treatments?